Hello, everyone. I'm Dr. Lola Ashaye, a board-certified family medicine and lifestyle medicine physician with special training in menopause care and the owner of InTouch Primary Care in Sugar Land, Texas. And welcome back. You're listening to Connecting the Dots with Dr. Ashaye. So in the first part, last week, we answered common questions about menopause. So go ahead and check that out in the previous video. And today we're going to be talking about how to actually manage perimenopausal or menopausal symptoms without guessing, without Googling, or trying to do it alone. So don't forget to subscribe, share this with someone who needs it. And if you're ready to get care that truly sees you and you're in the Houston area, go ahead and book a visit with us at InTouch Primary Care. Okay, so we're going to start with the most common symptoms. So this is what brings people in a lot of times, the symptoms. So hot flashes, night sweats, very common, but also poor sleep. Some people have mood changes or anxiety, and sometimes they get misdiagnosed with just, anxiety or depression, not related to hormone changes. Brain fog, also quite common. Vaginal dryness or pain. Um, Low libido can be an issue as well. Um, Weight gain, body changes, that's very, very common. Fatigue, joint pain, sometimes overlooked. Some people will have even frozen shoulder with changes in their hormones, and not just feeling like themselves. So those are symptoms that a lot of people, many common symptoms. There are many more, but these are many of the common ones that people will notice with perimenopause and menopause. So the good news is you're not stuck. You have options. There are proven ways to manage these symptoms. And usually I work with my patients to find the ones that fits their body, their life, because everyone is different. So let's start out with some non-hormonal options. So we all know lifestyle changes is really always the foundation. So healthy nutrition, physical activity, proper sleep, stress reduction, mental health support, those things are really important and they're always foundational. So specifically focusing on protein and fiber intake can be really helpful during this period. Sometimes supplements are needed depending on what's going on. Some people find magnesium helpful to help with sleep. Omega-3 can help with heart support and many other things as well. Vitamin D sometimes is helpful. So talking with your doctor to figure out what will work best for you. Then depending on if some people have vaginal symptoms and may need, vaginal moisturizer or lubricants if they wanted to avoid hormonal options. There are also non-hormonal medications that can be helpful during this period. So that can be an option as well. Of course, hormonal therapy, if appropriate, can be literally life-saving, can be very, very effective during this period because it is a hormone decline causing symptoms oftentimes. So estrogen can be replaced, which usually will help with hot flashes, vaginal dryness, sleep, mood, and much more. Progesterone is required for people on estrogen. And so if they have a uterus for uterine protection, but it also has a calming effect, so it can be helpful as well for symptoms and can offer, just um, symptom relief. So even if you no longer have your uterus in place, sometimes progesterone can still be useful to help with symptoms of perimenopause and menopause. And then testosterone in some cases can be helpful for libido. Some people find that they have more energy on it and it helps with muscle building and many other things. So those are the hormones that are typically used. And there are many safe, FDA-approved bioidentical options for hormone replacement. So what we do is we start at the lowest effective dose and we personalize your plan because it's not one size fits all. And it could take some time to feel better, but oftentimes when people feel better, it truly makes a difference for them. So here, my approach, and everybody's a little bit different, but I'll share that so that you can see if make sure that when you are being assessed for this, that a detailed job is being done. So full history is important to understand what your risks are, what your benefits could be, what your symptoms are. So a history should be detailed before starting because this is something that you're going to take for years and maybe lifelong in some cases. A physical exam, I like to do a physical exam, especially a pelvic exam, because it tells a lot about what's going on. It also helps rule out some things that are important to know. And maybe suggest what types of labs, like if the thyroid is abnormal, for instance, or there's something on the breast, or there's an abdominal exam is abnormal. It kind of guides whether or not labs are needed or required. And labs will be the next thing. So labs, you would want to rule out things that could cause similar symptoms. Thyroid conditions, you want to make sure that's optimized. You want to make sure the person is not anemic, and that has adequate iron stores. But you may also want to do other lab tests to figure out hormones, where the estrogen levels are, or the progesterone or testosterone, and all the other androgens, and just see how treatment might be affected, especially if somebody opts for hormone replacement therapy. And then goals. Everybody has different goals, and we try to tailor our treatment plan to the person's goals. So we decide together. So what it matters to you right now and what is most important to you right now, and that's what we focus on. So whether or not you choose hormones, the goal is the same: to help you feel better, to help you feel stronger, to help you feel clearer, to help you feel more like you again. And that's what this is all about. So it's a transition. It doesn't have to feel confusing or lonely. There is help, and it's not all for nothing. So in the next episode, we're going to break down hormone replacement therapy a little bit more. We're going to talk more about what it is for and what to expect if you try it. So if you found this information helpful, go ahead and subscribe, share with your friend, book your personalized menopause consult with us at InTouch Primary Care, and we'll love to help you thrive through this season of life. I hope that helps.